from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Daybreak. Wellness Wednesday, 6:24 is the time. When someone you know has a stroke, it's important to act fast, and that word is particularly important here. It's a matter of minutes, even seconds, and that could be the difference between a full recovery or potentially permanent damage. And in some cases, it could be life or death. So May is National Stroke Awareness Month. Joining us this morning to explain what a stroke is and what you should look out for, Dr. Devon Ballard with Sherwood Family Medical Center. Dr. Ballard, thanks so much for joining us this morning. Remind everybody just what's happening when someone's experiencing a stroke. What happens to them?
So the brain blood supply gets stopped for whatever reason. It could be embolic, where a clot blocks up a vessel, or the vessel can burst and can bleed into the brain. In essence, the brain's not getting the oxygen it needs, and that's pretty much what a stroke is.
I mentioned fast. Why is that word so important when it comes to stroke?
So fast is, F-A-S-T. Sometimes there's facial drooping or facial irregularities where somebody can't raise the side of their mouth. Arms, some people, you ask somebody to raise their arms, can they raise their arms on both sides? Speech, see if they can say a phrase. It doesn't have to be a complicated phrase. It could just be a sentence.
Okay.
So if they're having aphasia, and if you notice those things, then you call 911. I mean, the time you get somebody to the hospital to get them treated can make a big difference of possibly reversing if there's a clot in there, they can actually give some medicine to help break the clot up and get the blood supply back to the brain to help preserve some brain cells.
What about risk factors for this?
Well, significant. I mean, risk factors can be a lifestyle risk factor. So if somebody's obese, sedentary, heavy drinking, and then you have medical risk factors like high blood pressure, diabetes, high cholesterol, family history of stroke, COVID-19 history is actually an independent risk factor for a stroke.
That's a new one.
And then sometimes it just depends on who you are. Like males have more strokes than females. Hispanics and African Americans have a higher frequency of strokes than Caucasian. Women have strokes later in life, and they usually more women die of strokes than men because it happens when they're older. So there's a lot of different things in play. We're talking about strokes.
All right. Well, if you'd like to talk to your doctor, if you fall into those risk factors and you want to find out more, you can always contact Baptist Health. The information's on your screen, the Baptist Health Healthline, or you can go to baptist-health.com for more resources. Dr. Ballard, great to see you. We'll see you next time. Thanks again.